Hi friends, Ruth Werner here to talk about my current absolute favorite online self-paced continuing education class, and bonus, it is NCB-TMB approved for ethics credit too. It's called A Doctor's Note is Not Good Enough and What is Better. And in this Fun for All, we go through why we think doctor's notes matter. Spoiler alert, they don't do what you think they might do. And we talk about how to set up lines of communication that will get you what you really need, information to help you make good clinical decisions. Please join me for A Doctor's Note is Not Good Enough and What is Better. You can do it anytime that works for you and anywhere you have Wi-Fi. Visit me at ruthwerner.com to register today.
Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today's episode is one of my favorite types. It's a condition I know almost nothing about, except that it has something to do with pus and gangrene and someone who wants massage. What could possibly go wrong? My deep thanks go out to this contributor who sent me this story quite a long time ago, and it goes like this. I have a client diagnosed with Pyoderma Gangrenosum, with no known pre-existing conditions that might have been contributing immune or inflammatory factors. They reached out to me after months of wound healing, as some research had been done that indicated myofascial release or deep tissue might be avenues of approach for the restrictions they feel. They have also heard via healthcare providers that there's a slight increase in these cases, and there's some thought surrounding COVID infection as well. Other medical interventions are being explored as well, dermatology in particular. Your thoughts and expertise are appreciated. Well then, I read through this a few times, and I have to say I have an important question for which I'm going to just assume the answer. And my question is this. This client was diagnosed with Pyoderma Gangrenosum, we'll call it PG, and we'll get to that in a moment. And then we have a reference to months of wound healing, and then a call out about research regarding myofascial release or deep tissue massage. I'll come back to those terms later too, to help deal with restrictions, which I will propose are related to subsequent scarring. But the timeline here is not 100% clear. I'm going to move forward with this scenario. The client had PG, and then they went through a long healing period. And now they feel some fascial or scar tissue related restrictions, so they want to see if massage therapy might help them with that. Well, let's look at Pyoderma Gangrenosum and whether it might be related to COVID and what PG recovery entails. And then I'm going to have to get on a little soapbox that will probably make some people mad at me, and that won't be the first time. And then we will talk about options for moving forward. Pyoderma Gangrenosum. The prefix pyo means pus making. Aren't you glad you tuned in today? And derma, of course, is skin, so pus making skin. Awesome. Gangrenosum refers to gangrene, which means putrefaction of the soft tissues. Actually, just for fun, let me read to you about gangrene from the online etymology dictionary. Quote, putrefaction or necrosis of soft tissues, 1540s, gangrena from Latin gangrena, an eating or gnawing sore, literally that which eats away, a dissimulated, reduplicated form of gran, to gnaw, from the root grass, to devour, see gastric. Well, that's fun. Traditionally, we think of gangrene as an infection, usually with some kind of bacteria, and gangrenes of this type spread really fast. They are potentially deadly, and this kind of infection leads to thousands of limb amputations every year. But in PG, sores appear without an infectious agent. And this is really important because it changes treatment strategies. But remember, these are open ulcers, so they can easily become infected, but that's a slightly different problem. So do you get the idea? This person had sores producing pus that literally eat away at soft tissues, but with no infection. It turns out that PG is considered an autoimmune disease. This is a dysfunctional immune system causing all this damage. And then I found the pictures. Now, at this point, I hope you are glad that this is a podcast and not a hard copy article with lots of explicit photographs. It's part of my job to look at pictures of skin diseases, and sometimes this part of my job is just no fun at all. If you do want to pursue this and stumble onto pictures of these lesions, please be comforted by the knowledge that the reason those photographs were taken is that that person is now receiving medical care. Pyoderma gangrenosum typically appears on the legs, especially the shins. It usually starts as small, blistering, pus-filled lesions that become larger, open, and extremely painful ulcers. Fever and joint pain might be present, as we see with other autoimmune disease flares. For some patients, symptoms might begin with a minor skin wound that then initiates this out-of-scale immune response, and this pattern is called pathology. If a person has this history, then making decisions about wound care and surgery, that is, intentionally creating more wounds, becomes much more difficult. Pyoderma gangrenosum is treated the same way other autoimmune diseases are treated, with steroidal anti-inflammatories and immune suppressant drugs, along with extremely careful wound care that needs to both prevent infection and to not stimulate more inflammation. And this turns out to be a very delicate line. As we see with the description of our client today, it often takes many months. So PG is not an infection. The lesions are also not related to poor circulation like we see with pressure sores or bed sores, and they're not a complication of diabetes. They are, however, often associated with inflammatory bowel disease. And this actually answers a question I've had for a long time. I've been aware that during a flare-up of Crohn's disease or ulcerative colitis, those are the two things that make up inflammatory bowel disease, some people develop these large, painful ulcers on their legs. Now, in the past, I've tried to find out how those things are connected, and all I could find was systemic inflammation. That was much too vague for me. Now I have learned that what we're seeing is Pyoderma gangrenosum. It's often connected with inflammatory bowel disease. In fact, about half of all of the cases are connected to IBD. Other cases of Pyoderma gangrenosum might be related to other autoimmune diseases like rheumatoid arthritis and some others, and it is occasionally seen in the context of certain kinds of blood cancers. But none of this is the case for the client in today's I Have a Client Whose story. Remember, our contributor said, I have a client diagnosed with Pyoderma gangrenosum with no known pre-existing conditions that might have been contributing any immune or inflammatory factors. Well, that's great. However, because PG is autoimmune, it might well occur again, especially in response to any minor skin wounds. And this is something both the massage therapist and the client should be watchful for. It's also possible that this client must now use immune suppressant drugs for a prolonged period of time to help suppress the outbreak of other lesions. I did look up to see whether there's been an uptick in PG diagnoses since COVID, and I found a case report about someone who had a history of this disease who got a new flare after one of the vaccines, and the authors suggested this was related to an immune system response. And I found a collection of case reports about post-COVID infection cases, but really no data on whether there's some kind of link between COVID and Pyoderma gangrenosum. Okay, let's return to our story. What is in the best interest of this unusual client who would like to restore some freedom of movement after accumulating a lot of scar-related restriction? Not surprisingly, there is exactly no data specifically about massage therapy for a person who's had PG. I did dig around a bit for exercise guidance for people with this history and found that exercise is encouraged as long as healing is complete and the risk of skin wounds is low. That said, we do have some research about massage therapy, whatever that means, and scar tissue. And I'm guessing that this is what our contributor is referring to in their question about the research. I want to repeat what our contributor sent. This client reached out to me after months of wound healing, as some research had been done that indicated myofascial release or deep tissue might be avenues of approach for the restrictions they feel. Oh boy, two of my favorite terms. I mean, massage therapy is already sometimes problematic, right? Because we don't have a great universal agreement on what that even means. If you're interested to see what smart people have used for definitions, let me know and I will hook you up with some great articles. That said, I want to point out that our profession is not alone in this. Many professions struggle to create a simple and succinct definition for themselves. But the term myofascial release is a particularly difficult one for me. Not because I don't like this work or I don't believe in it, but because it just doesn't give a lot of information about what's really happening. I've had treatments that were labeled myofascial release that were deep and painful and difficult to tolerate without really focused breathing. And I've had treatments that were feather light, and in my experience at least not particularly impactful, that also called themselves myofascial release. And of course, I've had many skilled massages that focused on warming, stretching, and improving the function of my recalcitrant muscles and fascia, and that's why I keep going back for more. I take issue with this particular term because it's not very descriptive, and people outside the massage therapy profession will use it without understanding that it's not very descriptive. And also because for me, the word release is highly problematic. With all respect to the originators of this kind of work, what is being released? And don't we as a profession already have enough trouble distinguishing ourselves from the sex trade without incorporating words like release into the way we describe our work? I took some time to look it up. I searched, what is being released with myofascial release? And I got some responses, interestingly, starting with the Cleveland Clinic and the Mayo Clinic. And they said that myofascial release releases tightness and pain in muscle and fascial tissues. Well, okay. At least this is better than the very antiquated idea that it, quote, releases adhesions, unquote. Now, moving on to the term deep tissue, I find this also vague and often not very accurate. It's one of those terms that anyone can use to mean anything depending on their preference and context. The common denominator seems to be how much pressure is exerted, but shouldn't that vary with each individual? I realize that consumers often have an idea that deep tissue is somehow better than regular massage, but boy, I'd love to see us evolve away from that kind of language. Now, I really hope I don't get a bunch of hate mail about this because really all I'm trying to do is to communicate clearly. And in the end, what will be best for this client? I maintain that myofascial release or deep tissue massage are terms that are not specific enough. Let's think about skilled massage therapy that focuses on warming and then gently and within tolerance, stretching the involved tissues without causing further damage. And this seems like a great idea for this client. Do you want to call that myofascial release? Be my guest. But I maintain that it's just not a label that conveys adequate information. The issue of the impact of manual therapies on scar tissue is one that's been cropping up for me a lot lately. And I just want to give you a little preview that my next episode of I Have a Client Who will feature a short interview with the person who I believe is the go-to expert about the interface between manual therapies and scar tissue. And she is a wonderful practitioner named Kathy Ryan. So keep listening. And by the way, I want to let you know that I am coming to the very bottom of my list of stories people have submitted, and I need some more of your I Have a Client Who stories. So let me know, and I'd love to hear from you about your perplexing cases.